Hi, my name is Dr. Sameer Kaul. I work as a surgical oncologist at the Apollo Cancer Institute in New Delhi. Head and neck cancer is a very common cancer in our part of the world, and what it becomes quite sinister and disabling at some other point of time always begins as something very, very small, something very, very subtle that you need to be aware of. For instance, in the oral cavity, whitish patches that we call leukoplakia, or even sometimes reddish and velvety colored patches anywhere in the oral cavity are sinister. They're called erythroplakia. So leukoplakia and erythroplakia are the harbingers of something which is quite sinister and is cancerous later on in life. So you need to be aware of them. So a jagged edge of a tooth, chewing of pan and tobacco, and things like pan parag and gutka are things that you need to be very, very, very careful about, and always counsel people against using them, because that is where it all starts. A simple earache on that side, a pain in your ear, can be signifying a tumor in the tongue on that side, which you can't see. Any ulcer in the oral cavity which refuses to heal on its own or after the use of simple antibiotics is another thing that you need to be careful about. Any of these things, or a bloody discharge from your mouth, or even, for instance, a hoarseness in your voice which has just happened over the last couple of weeks, you need to be very careful about, and you need to report it to a physician and try to find an answer for it, because these are subtle indications, or even small lumps that may appear in the neck anywhere. You need to bring it to the notice of your doctor and find an answer for it, because these could be the potential early signs of cancer that comes in later.